It looks like we are live. Hey everyone, hey everyone, we're back at it again. I have got a really awesome guest to talk with us today about her, I guess, history with law, her history with epidemiology, if that's the term correctly that I use. Hopefully I said it right. We've got Elizabeth Booker today, so I hope you enjoyed today's discussion, and I think I will enjoy today's discussion. So let's enjoy. Okay, all right. So let's just jump right in. Without further ado, how you do, Elizabeth?
I'm great. How are you doing?
I'm doing pretty good. I'm doing pretty good. The weather is kind of sucky down here in Texas today, but I wanted to at least do something. I'm consistent with this. I've been doing this now almost the past month and a half, and wait, hold on, almost the past month. What am I talking about? And it's something that I enjoy. Just I notice people from afar, and I like giving people an opportunity to show off a little bit, I should say. Talk about who they are, and I like to have others learn and get the opportunity to have a discussion with, um, and learn from these people that I bring on here. So I brought you on here because I saw that you had some degrees that I personally will be getting into myself. So I wanted to have that discussion with you. I saw that you had a degree in public health and you've got a law degree. And
Yes.
so, before we get into that, let's just talk about who you are and what's your background and all those different things. So, talk to us, Elizabeth. Who are you? Who are you? Why should we pay attention to you? What are you all about?
So I am Elizabeth Booker Houston, go by Liz.
Mm-hmm.
Born and raised in Memphis, Tennessee, but I have relocated to the Washington, D.C. area for work.
Mm-hmm.
Um, as of September 2017,
Mm-hmm.
I do work for the Department of Health and Human Services in the FDA as a social scientist. And this is a great moment to make it clear to everyone that everything that I'm stating here are my own personal views and opinions. They are not the views and opinions of the US federal government.
Mm-hmm.
And that I share that I work for the FDA simply as a piece of biographical information, not as an expert opinion on anything I'm stating here. Um, but yeah, born and raised in Memphis. Um, I went to Christian Brothers University,
Mm-hmm.
a very small Catholic university in Memphis, private school,
Mm-hmm.
where I pursued my bachelor's degree in psychology. And I focused on cognitive neuroscience. And I worked in cognitive neuroscience research while I was an undergrad at the University of Memphis in their laboratory.
Mm-hmm.
Um, and wasn't really quite sure what I wanted to do. I didn't know if I wanted to go to medical school or get a PhD. I
Mm-hmm.
spent the subsequent summer with the Minority Health Institute for Research Training, known as MERT. It's an NIH funded program that sends undergrads and grad students, med students they send them abroad to either countries in Africa or where I
Mm-hmm.
went, which was Brazil, where we could do research. And I worked in a Brazilian biochemistry lab
Wow. Okay.
for some time. And I was 22 and first time out of the country, and I did it all alone.
Mm-hmm. Mm-hmm.
Came back, still didn't know what I wanted to do. I interned at Le Bonheur Children's Hospital in Memphis
Mm-hmm.
as a cardiology research intern. And it was around that time I started talking to a doctor, and he said, "Well, what do you want to do?" I said, "Well, I've started taking some courses to try to get into medical school because with a psychology degree, I had some of the requirements, but not
Mm-hmm.
all of things like organic chemistry and higher level biology classes I needed to
Yeah.
take." And I was miserable. I didn't enjoy the classes. And the doctor I worked for said, "Why do you want to do this?" I said, "Well, I want to work in I want to change like healthcare and health policy and public health." And he was like, "That's stupid. Don't be a doctor, be a lawyer. Doctors don't get to do that." um, and it never occurred to me because my idea of lawyer was law and order or, criminal defense or just suing people. And I
Yeah.
had no
Yeah.
interest. Yeah, I had no interest in practicing law or doing those things. Well,
Hmm.
it was then I found out about the world of public health law and policy work. And I was like, okay.
Hmm.
So with there were 6 months that passed from the
Wait,
time I talked to that doctor.
are you tearing up about public policy? I saw
Oh
already.
no, no, not tearing up yet. But I might tear up later when I start talking about other things. I don't know.
Okay, I got you. I got you.
But no, there were 6 months that passed from the time I had the conversation with that doctor to the time I started law school. I just kind of was like, okay, I sat for the next LSAT. I applied to University of Memphis because it was local, got
Hmm.
accepted, and I showed up in August of 2015, and I just kept showing up. And somehow at the end of it all, in that time I'd enrolled into a dual JD and PH program. They said, hey, we
Hmm.
want to try this out. You'll be our first graduate to have both of these degrees. So I got to
Wow.
be a guinea pig, and basically get 2 degrees for the price of one, which was
Hmm.
nice. And yeah, by 2017, I'd had both my JD and my Master of Public Health, um, and I applied for a very prestigious fellowship with absolutely no expectation of getting it. And then I found out I was named a presidential management fellow, and that's how I was brought to
Wow.
Washington, D.C. So yeah, it all happened really quickly. It's so funny because I feel like I just turned 30 last month. I feel like I was 18 yesterday. Like I've just been going for
Hmm.
so many years.
And
So
time just kind of flew right by while you're getting your
yes,
education on, huh?
yes, yes.
I would call you almost like a role model for a lot of young ladies and boys who are, looking for someone who is well educated, who comes from Memphis, Tennessee, who's looking up for someone. And I think you
Yeah.
probably fit that mold.
I hope so. I mean, I would hope so, and especially for young kids who don't come from means, because a big reason why I got so passionate about health policy and wanting to work in healthcare is I, as a child, had a lot of I have very severe asthma and some chronic health issues that I dealt
Hmm.
with. So I spent a lot of time getting to know the children's hospital that I later went back to work for
Hmm.
as an adult. But we didn't grow up with a ton of money by any means. Memphis as a whole is a very impoverished city, and I think I do want to be that kind of role model for young people who are like,
Yeah.
okay, my parents aren't wealthy, I don't have everything handed to me on a silver platter, but I can still make it. um,
Okay. So, what things did you do to put yourself in the position to get where you're at right now,
um,
education wise?
Education wise, I said yes to opportunities. That is the
Mm-hmm.
best piece of advice that anyone could ever give me. I had a mentor give me that advice years ago, and she
Mm-hmm.
said, don't be afraid to just say yes. It can be weird, it can be random, it can be a job that you never thought that you would do. And I mean, I've said yes to a lot of jobs. I said yes to working at a Halloween store wearing a costume, and I've said yes to a biochemistry internship in Brazil. I say yes to a lot of things, and I just kind of go for it. Like if there's no reason for me to say no, if it's not something dangerous or harmful, and it might prove to be, a really cool opportunity, just
Yeah.
just go for it. The only recommendation that I give that to others that I say don't follow in my footsteps is try to not go into as much debt as I have for my education, if at all
Yeah.
possible. Um, I always say my sister did it really well by there's multiple ways to do it. My sister was in the army, and so she got her bachelor's and her master's for free, and she also works for the
Hey.
government. So she
Hey.
yeah, exactly. So you understand that. But also the military is not the only way to go.
Hmm.
A lot of community colleges offer free associate's degrees now. My niece, because she started at the community college level, is now going to graduate with her bachelor's in radiation therapy completely debt free, because she decided, hey, instead of going straight to a 4-year university, let me start with this free 2 years that I can get,
Yeah.
at a local community college. So I always tell folks, try to explore your options. I got very lucky that I ended up working in a position where I have some of my loans paid for me and my loans will be forgiven, but I got very lucky.
I wouldn't say luck. I wouldn't say luck. typically, you tend to see those who work very hard and put themselves in those positions of yes tend to have all the luck. So I won't say that you just got lucky and things fell to you. I think you worked very hard to get where you're at.
I did. I worked very hard and both in and outside of school. It was not always easy. Like I said, didn't come from wealth. So I worked a full-time job starting from the time I was 19
Mm-hmm.
and took full-time course load at the same time. So I had a very unique undergraduate experience in that
Mm-hmm.
I had a full-time job as a teenager, and that's not the most common thing to see. And it was exhausting and hard, but
Mm-hmm.
I'm really glad that I did it. And it taught me, great work ethic, and also gave me something to fall back on if college didn't work out. I
Okay.
always tell people that have a backup plan. And so, I made sure that I had some actual real workforce experience along with my education.
I would say that you've kind of embodied a lot about what Memphis is really known. Well, I should say Memphis Grizzlies are really known for, like about 5 to 10 years ago, grit and grind, but still
Yep.
came out and worked.
Yep.
I think you've definitely embodied a few of those things.
Yeah, my city had a huge impact on me and my development.
Mm-hmm.
For sure. You definitely learn to grit and grind when you are growing up in Memphis. Like I said, my niece, she's 21 years old. And so many
Mm-hmm.
people are shocked to see where she is at this point in her life. And it's because she has that same mentality of grit and grind and work hard. And just
Mm-hmm.
like me, she's worked, a full-time job all through school too. So I think it
Yeah,
kind of also just runs in my family. Like we all kind of just do what we have to do.
I got you. I got you. So let's talk a little bit about your motivations when you went to college and the degrees that you chose. You said that. Wait, hold on. I think my hand is kind of messing with the focus. So let's put my hand down. You talked about asthma, that you grew up with asthma in Memphis. Is asthma a chronic condition?
It is. It is a chronic condition. It can be mild to severe. I unfortunately had a very severe case of asthma quite a long time growing up. I was 3 when I was diagnosed after a few hospitalizations. And I remember when I was 4, there was a point where between the ages of like 4 and 5, I had to do 3 nebulizer treatments every day just
Wow.
to kind of manage my symptoms. Whereas usually that's an emergency treatment that you would only
Hmm.
do when you're having like some sort of attack or a flare up. um, and just dealing with that. I know the hospital uh, way too well. As a
Hmm.
kid, I laugh because I became so well acquainted with the emergency room and with specifically Le Bonheur Children's Hospital that it the only place that I can sleep soundly is a hospital to this day, which is so weird because most people are like, no way. But when I had my little boy, I gave birth to him in December.
Hmm.
And my insurance covered up to 3 nights in the hospital. And the doctor said, well, we can discharge you early if you, I was like, oh no, I want all 3 nights sleeping. And then they said, well, the baby doesn't go to your nursery. You got to keep your baby in the room. I said, oh no, I want the baby in the
Hmm.
room. I just want to sleep in this hospital bed because I love sleeping in a hospital. They thought I was nuts, but a lot of that comes from my childhood. And just I always say that hospitals can be scary places, but for me as a kid, it was a place where I can't breathe, and now I'm here, and suddenly everything is okay.
Wow.
So the healthcare system was it it brought me a sense of safety and security, and not fear.
That's interesting because, I'm going to add on to what you just said there. A lot of folks today, and, justifiably so, don't really trust the healthcare system, don't really trust because of a history of them experimenting on people of color.
Yeah.
But you've kind of got the opposite feeling and experience with the healthcare system.
Now, that's of course my specific experience because I was very fortunate that
Mm-hmm.
Memphis has a phenomenal pediatric care
Mm-hmm.
hub between
Mm-hmm.
St. Jude and Le Bonheur. Children are very well taken care of.
Mm-hmm.
But as a woman of color, and especially when I was pregnant, as a pregnant woman of color, I
Mm-hmm.
definitely had concerns about giving birth because we do experience a higher infant and maternal mortality and morbidity
Yes.
rate among especially Black women and children in America. And um, that sense of safety that I felt in keeping, staying all 3 nights at the hospital was
Mm-hmm.
because I am very fortunate that I gave birth in Silver Spring, Maryland, which is a very diverse sort of area as far as ethnicity, religion, race. DC as a whole is very diverse, but Silver Spring especially. Dave Chappelle is actually from Silver Spring, Maryland. That's
Hey,
if you were wondering.
I'll tell you this. I'll tell you this. Just a quick add-on. If there were one place that I can move to from San Antonio, Texas, where I'm at right now, it will be Washington, D.C. I love that city. I love that city when I was there.
Amazing. It's
Hmm. Hmm.
amazing. And there's so much just the level of tolerance and understanding
Hmm.
and the
Hmm. Hmm.
progressive ideals. It's such a wonder, especially
Hmm.
after living in Tennessee. Now Memphis is a blue dot in a red state, but I mean we still experience that. It's
Yeah.
interesting to move to such a progressive area,
Hmm.
and my care team, all women of all different races and backgrounds, and that's what made me feel very safe, is that I did not have that concern. I knew I was going to be heard and cared for, and I always say that it is very unfortunate that other women can't
Yeah.
always say the same.
Hmm.
So when I hear people say that they want to try a home birth or they need to have a doula present,
Yeah.
all of these different additional support
Hmm.
systems, I totally understand that and support that because it is definitely needed. So I do like to, I think that my experience is definitely an exception and not the rule in many cases. So I don't use my experience to just write off other people's concerns. Their concerns are absolutely valid and these problems do exist. And I was just fortunate that I was born in a city with this amazing pediatric
Yeah.
hospital.
So you don't let your anecdotal situations formulate the way how you think everything is, and that's
No.
definitely admirable. Well, I would think that you being, someone who went to law school, you would know definitely don't fall into that trap.
Oh yeah, yeah. It boggles the mind to see how people are so susceptible to that nowadays. Of,
Yeah.
well, because I experienced this must be the way it is for everyone, which is
Yeah.
ridiculous because my thought process a lot, most of the time is I experience this. I wonder how it is for those people over there.
Hmm.
I'm always kind of thinking, how is it different elsewhere or for this person or this group? Maybe that comes from, being from a minority group. I am biracial. My dad's Black, my mom is white.
Hmm.
Um, Growing up in Memphis, that's not always the easiest thing. I was born in the
Hmm.
90s. I think things have definitely shifted and changed now for the better, which
Hmm.
is great. But I think it's easier sometimes for those of us from certain disenfranchised and minority groups to have more empathy and more understanding and to understand that our perspective is not the only one because we know what
Yeah.
it feels like. We know what
Yeah.
it feels like to be discounted and to have our thoughts and feelings be treated as if they don't matter.
And just as a disclaimer, just because you may not be of a minority race or subculture or whatever, it doesn't mean that we don't think you can't be empathetic to those
Yes.
that are in minority races or subcultures. So just
Absolutely.
yeah.
And to point out, my husband is white and he is absolutely, empathetic and understands,
Mm-hmm.
and he is an ally and he is a support for me, which is why we're married.
Mm-hmm.
And yeah, there it's definitely possible for all people to feel for one another. It's possible.
Yeah.
It's just, do you want to take the time to actually try to learn to actually empathize with a group of people who are unlike yourself?
Got you. And that unfortunately is not something that those who are in power, when I say power, those who formulate laws or policies, they may not necessarily share that mindset. They may want to just appeal to their core group or their base group.
Yeah, that is something that came up a lot, especially in legal studies in law school. We talk a lot about the history of the law and how certain prejudices and biases
Mm-hmm.
shape the foundation of our laws. And whether it's a very intentional, conscious prejudice of like, I want to target this group, or whether it's an
Mm-hmm.
implicit, unconscious bias. Either way, it can be harmful. There's you know, an excellent workshop, and I can't remember the website right now, where you can actually take the implicit bias assessment test, and you can kind of see where your unconscious bias lies. And it's a very eye-opening experience, because people who would consider themselves to, not be prejudiced, not be discriminatory, may find that they actually do have some biases they aren't aware of. It doesn't
Yeah.
make you a bad person. We all have them. It does not make you a bad person. Especially because so much of it is ingrained by society, and we can't help. It's shaped by what has been, put in our faces from birth, in the media, out in the world. It's what makes you, what I would say, I don't even want to call you a bad person, but
Yeah.
what makes your actions bad is when you become aware of these biases and you refuse to then, remedy that.
Well, before we go down that trail of talking about implicit and explicit bias, let's break it down. Let's break it down in simple terms. What exactly is implicit bias versus what is explicit bias? And give some examples also.
Yeah. So, and I'll give personal, I can give personal examples. I don't want to attack anybody. So talk about myself. So, an explicit bias is something that, okay, I have decided to feel this way. This is what I think, and I am aware of it. So a bias, and it can be anything. So I can say, like, a bias that I have is if I see an older kind of guy at the club, I just assume he has the intentions of, trying to find a young lady to take care of. So that's a funny one. But, and I'm like, okay, I know I'm going to stay away from that guy because that's suspicious. I'm explicitly biased in that case. I'm outwardly biased. I'm consciously biased. An implicit bias is where you are completely unaware on a conscious level of a bias that you might hold. And so a much more serious example that I give is during an implicit bias workshop that I participated in some years ago. The instructor put different words on the screen and asked us to write down what was our first image that came to our mind. And one of them was terrorist. And I immediately pictured an Arab person.
Wow.
And that was very eye-opening for me. I know outwardly that, this is what I would never say, that a Muslim person or a person of Middle Eastern descent is automatically a terrorist. And, I have a very strong conviction there. But because of the way the media has always been coming in and
you've been socially conditioned.
I've been socially conditioned to just have that be the first thing I think of. And I wasn't consciously aware of that, and just started to think of all the ways that, try to be aware of that unconscious bias is then acting out physically in some way. Like, do I tense up if I see a person of this image when I go to the airport? Like, just automatically, like, how do I react to these people? Do I have to then consciously correct my behavior because of this unconscious feeling?
So, for example, I grew up in the Caribbean, born and raised in the Caribbean. And in my Caribbean island, we had all different types of backgrounds, cultures, from Hindu to Christian to Muslim. And I never really thought of race when I was growing up. I thought of this person is a Trinidadian, and that's normal to me. And moving up to the US, and then, learning, people giving you social constraints like, hey, if you're Black, you have to hang out with these folks. Or if you're white, you've got to be this way. Or if you're Hispanic, you got to be that way. I didn't really want to fix myself into that constraint. So learning about this bias that people had against Muslims and all, it was weird to me. It was absolutely weird. And it's something that I still don't really accept, because I believe you kind of limit yourself when you, I don't know what the terminology is. The terminology of when you kind of have one fixated way, and that's the way how you're going to be. You're looking for confirmation bias in a lot of the things that you see Totally. Look at us talking like psychology majors.
We must have psychology degrees or something.
We must. But let's talk a little bit about how public health and policy go hand in hand and how they affect the way how things are today.
Oh gosh. Okay. So
And
the first
you're talking as Elizabeth, not as USDA worker,
Oh yeah, of
whatever.
course,
This
of
is
course.
your opinion.
So the first thing I like to start with is explain to people what public health law is, because even lawyers are like, I don't know what that is when I tell them
Mm-hmm.
that I work in public health law. So public health law are basically any of the laws, regulations, um, common law that we have
Mm-hmm.
that impacts the public's health. It's that simple, but it's also very, very broad. So what are some examples of that? An example of that would be, say you have a law
Mm-hmm.
about adding fluoride to the drinking water because it's going to help strengthen
Strengthen
teeth.
your teeth. Yeah.
That's a public health law, very obvious one. Some public health laws that aren't so obvious that folks might not think of as so. Say for example, you have a zoning law, and this
Mm-hmm.
zoning law is suddenly going to get rid of sidewalks in a neighborhood. That affects the community's ability to have a walkable neighborhood, which in turn could
Mm-hmm.
affect cardiovascular health
Mm-hmm.
because they're not able to get the proper exercise.
You're talking about the exact same thing that a guest of mine about 2 weeks ago spoke about. Antoine. Antoine. He is. Oh man, let's keep going. Keep going. I'm loving it. Keep going.
So that is just public health law generally. Specifically, the kind of work that I have done. So I have worked in research with adverse childhood experiences, or ACEs,
Mm-hmm.
and what that is it's a psychological study that was conducted that basically found that individuals who had a certain ACE score. So what that is there are 10 questions. And if you answer yes to these questions, you know how many yeses you have is your ACE score. So anywhere from 0 to 10 could be your score.
Mm-hmm.
The researchers found that individuals who had certain number of ACE scores and higher were more prone to have issues like different chronic diseases, more prone to drugs, risky behavior, tobacco use. And the kinds of questions on this questionnaire include things like, I witnessed violence in my home, or domestic violence between the parents, or I witnessed drug use or have a parent who was addicted to drugs, or there wasn't always enough food in the house, or different things that kind of get at issues such as food insecurity, housing
Mm-hmm.
insecurity, violence, alcoholism, drug abuse. And so this study found that children who are exposed to these things from an early age can experience something known as toxic stress. So and sorry, I probably don't want to get too
Wow.
off the reins,
No,
but
no, keep going. Keep going.
so there's 3 different kinds of stress. There's tolerable stress. That's
Mm-hmm.
what we experience in our day to day of, ooh, it's late. I got to, run to this meeting, or I got to get to class.
Mm-hmm.
That's the kind of stress that we all experience. There's acute levels of stress. And so that's where you might have an event that happens where you experience a stressful period of time. So losing a loved one is usually an example of that, because
Mm-hmm.
you're in that grieving process. And then there's toxic stress. And so that is where you experience on a daily basis repeated incidents. For example, if you experienced abuse, witnessing drug abuse, alcoholism in the home every single day. And when you experience toxic stress, it actually can affect the neural pathways in your brain as a child and completely change the structure of your brain.
Wow.
And so this research has been very impactful. And we are now seeing where it crosses over into public health law, with public health and the law, is that legal systems and different governing institutions are trying to be what they call more trauma-informed. So what does trauma-informed mean? It means that they are going to take these different policies from the ACEs research and try to apply that into a real-world setting to help these adults and children and teens who have these higher ACE scores. And I believe that they found that 4 or more tends to have a pretty significant impact on health. And so the kind of research I did was I researched ways that say a juvenile justice system can be trauma informed. That could mean providing very specific resources for a child who has a high ACE score, because we understand that due to the toxic stress, they aren't able to interact with the world in the same way that someone who wasn't exposed to that, how they would interact. I specifically worked with LeBonner when I was in law school to develop an ACEs questionnaire, because there's this amazing program inside of the Children's Hospital called the Medical Legal Partnership. And there's many of these across the country. It is where they put legal services inside of children's hospitals and help low-income patients who need some sort of legal services because they are dealing with some legal issue that affects their health. So I'm derailing a bit, but I'm going to tie it back to ACEs in just a second.
It's okay.
So to explain what the MLPs do, the classic example is that they say you have a child with asthma and they're coming into the hospital all the time to the ICU. They're taking their medicine correctly. The dosage is maxed out. They're doing everything they need to do. And the doctor finds out, oh, wow, they have a slumlord and they're living in substandard housing and there's mold and roaches, and that's constantly triggering the asthma. And unless that is taken care of, no matter what I do, this kid is going to keep getting sick. That's where the MLP comes in, is that they can provide these legal services to then take that landlord to court and help get these children and their families into safer housing. So I helped develop an ACEs questionnaire that it was a draft. So I don't know how much of this changed since, but I kind of did the initial work on developing a questionnaire for these children and the parents, so that when the clients would come into the clinic, they could fill out this questionnaire, and that would help us tailor the services that they needed.
Wow.
So it's all very interconnected. There's a lot of work to be done. So when I talk about public health law, it starts at this very basic level, but then you start talking about psychological research and legal services and going to court and ordinances and laws, and it's a whole big map that is all connected.
I had a Dr. Nifley. He's my frat brother. He was on about 2 weeks ago, and he spoke about how racial trauma actually affects physical health, as historical racial trauma, how it affects physical health today. And so now you're bringing the heat when you're saying, hey, health and health policy actually affects the way how things are today as well, traditionally. And wow. Do you have any more you want to add on to that? Because I'm like, keep talking.
So I can talk a little more specifically about what I do now. So I ventured into the world of privacy law. Okay, so this is where people are like, okay, wait a minute. Talked about public health law and all of these things. How are you in privacy law? Well, of course, our government and other institutions do a lot of human services research. They do a lot of healthcare research. And that, of course, involves collecting the information of a lot of groups, a lot of individuals, a lot of personally identifiable information, or what's known as PII. Yes. And so we need to make sure to protect this PII, especially when it comes to dealing with vulnerable populations.
Like the elderly?
Refugee youth, minorities, people who have a relationship with the justice system or have interacted with the justice system, low-income individuals. Yes, we want to make sure that vulnerable populations have their information protected, and we want to make sure that especially sensitive PII, vulnerable or not, we want to protect everyone's information, of course, because there's so much amazing research being done. But we have to be careful about how we collect information, and also really examine what we're doing with this information and make sure that there's not a bias in how we're conducting our research, or how we're collecting the information, or how we're sharing the information. And on the flip side of that, so I'm not a practicing attorney. That was never my goal. God loves, I have so many friends who are practicing attorneys, and they do amazing work. I had a small taste of what it was like to be in the courtroom when I worked for the MLP. And I'm very proud of the work I did, but I could not do that on a day-to-day. It takes a very special person. It's very taxing. So instead, I like working at the policy level. And along with doing legal policy work and that sort of legal research and application, I do get to also work as a researcher in a way. So I do also work on the research side of things. Um, Recently, I've switched over to working in tobacco research.
Yeah.
So that's probably a little more obviously public health. Folks can see
Hmm.
that, if we reduce smoking and tobacco use, that obviously improves the public health.
And
So
that's a long-term chronic sort of thing that you could do research on.
yes, there's so much needed. Tobacco use is still very prevalent, and especially with Juuls and different vaping
Yes.
devices and
Yes. Hmm.
and electronic cigarettes and those sorts of things. So again, I'm just speaking as myself,
Hmm.
but I think that's kind of a common knowledge that everyone can
Yeah.
can appreciate that smoking it is not great for the health.
I got you. So let's transition a little bit now into the current, I would say it's more acute, this current pandemic that we're dealing with, and possible long-term ramifications of it, and how you will, possibly have a role in dealing with policy.
Oh, so I have no idea what my role is going to be in the future
Okay.
because so many moving parts right now. But that's because I'm going to be honest. I don't think anybody knows what their role
Yeah.
is going to be just yet, but it's definitely going to change things. So um, the first thing that I found very interesting was, one again, a very common example of public health law that almost never comes up because it's so rare is what happens in the case of an epidemic or a pandemic. I
Yeah.
spent a long time theoretically discussing quarantine, isolation laws, these kind of stay at home orders. And now to see it actually in
Yeah.
action is very,
In law school,
very
didn't you
wild.
didn't you have to do research on, say, the 1918 pandemic and how they dealt with it?
Actually, no. That did not come in my formal legal education. It actually came up because I decided to carve out this public health law path, and I interned at the CDC while I was in law school for their
Hmm.
public health law program. And so I was very fortunate that I got a very up close view of these laws that most law students, I don't think many law students are exposed to this, but I bet they will
Hmm.
be now. I,
Yes.
really with law school, you're trying in 3 years to pack in everything you need to pass the bar exam. So that's,
Hmm.
criminal law and property law and basic things like that. There's not a lot of time to talk about pandemics that'll probably never happen. Obviously it did, but
Hmm. Hmm.
at the time, you're thinking, oh, the last pandemic's 1918. Why are we
Hmm.
going to put that in our curriculum? But I will not be surprised to see law school curricula change a bit after this to really go in
Oh, it's
depth about
coming.
these
It's
laws. Oh, yeah.
coming. Big
Yeah.
time. And I may be one of those law students who
Yes.
will be studying at eventually. Let's talk a little bit about, um, there are some health policies that are enacted. There are some things that actually go on that people really don't have full knowledge on, but they're unfortunately susceptible to internet pranks,
Mm-hmm.
conspiracy theories, etc. What can what can one do to become a better informed public when it comes to health public policy?
Okay. So the first thing that I recommend is I really, really, really recommend folks to understand the best they can, just at a layperson level, to understand jurisdiction and how that works. And so I'm going to explain a little bit of that here. So because that will clear up some things. So let's talk about this pandemic specifically. So a lot of folks are saying, okay, early on, when folks didn't take it very seriously, I know some
Mm-hmm.
people still aren't, but especially when folks weren't taking it seriously, they said,
Mm-hmm.
if this were serious, the federal government would shut us down. Okay, that's not going to happen because we do have the federal government and then we
And the
have
state
state
governments.
power.
There you
Exactly.
go.
And so people
Mm-hmm.
keep asking, why are we looking at the state or the city or our county
Mm-hmm.
to put in these stay at home orders? Why don't we just have a national stay at home order? Well, we can't do that. That's not how our jurisprudence system is set up.
Mm-hmm.
So you have some very express powers given to the federal government as outlined in the Constitution. And then there's in the Bill of Rights, which most people tend to stop, I think, after plead the fifth. I don't think a lot of people know 6 through 10.
Mm-hmm.
But number 10 is very important, and that's the reservation that has the reservation clause, which basically says that any powers not expressly delegated to the federal government go to the states. So that means that the federal government wasn't explicitly given this sort of public health power.
Mm-hmm.
It's up to the states and localities to go ahead and implement their own laws. And so that's why we didn't see the federal government immediately shut things down. Where the federal government has power is over things such that affect things like interstate commerce. So ways to reduce risk of transmission from state to state, or international travel. So we did see that happen with the way that different flights were shut down. There are various public health laws that allow states to use the federal government for help. And so that's where a lot of people get confused, as they say, well, doesn't the CDC come in and help sometimes? Like, haven't they done that in the past? Well, your state has to request that help, because the CDC does not have the authority as the federal government to just step in and take over. So if your state requests for the CDC to come, they absolutely, will. I don't know. I don't know exactly what their process or procedure is for evaluating how to help and what sort of, it's there. That CDC is huge, and I worked in one tiny part of it. But they definitely do have that power to come do that, but only when requested. So that is the first major thing I want to put out there, is that we've got to understand authority and power. And I think that will clear up so many misunderstandings for a lot of people. The second issue that I don't know, unfortunately, what the answer is for this, but we have got to get people to stop spreading conspiracy theories. I know that there's a distrust of the CDC. I know that there's a distrust of these organizations. But I don't think that some random guy on YouTube who's ranting for 30 minutes and has absolutely no credentials is the way to go for your info.
But Plandemic seems so legit, though.
I will be happy to speak on Plandemic very quickly. So the woman in Plandemic, let's be very clear that in 2011, and there are many public news articles with the date and time stamped on there so you can see, she was fired from her job for falsifying data on chronic fatigue syndrome. And she basically lied and said that CFS was caused by a virus that I believe was connected to a mouse.
And her test was not replicated.
It was not able to be replicated. And she was trying to get some fame off of some fake results, very similar to Andrew Wakefield.
The autism doc. Yes.
Andrew Wakefield, who completely falsified those documents and that research to link autism to vaccines. And he has lost his license. And this woman from Plandemic was fired from the lab. And so now she's trying to say that she was arrested some years ago because of Dr. Fauci, when no, she stole from the lab that she was fired from. And it's public information. Anyone can find that. So it took me 30 seconds to Google. And so I would just recommend people to dig a little bit deeper. And we talked earlier about confirmation bias. And we all have issues with it. I definitely succumb to it because, nobody wants to be wrong.
But unfortunately, a lot of us kind of overestimate just how smart we are. What's that term again? When
Dunning-Kruger.
That's it, Dunning-Kruger. Hey, it's okay to not be as smart on something that you think you're smart on. Allow the experts to show and explain to you that, hey, what you're believing is not actually correct. Here's the evidence, and you take it for what it is.
And that I am always surprised by folks who are very, very confident in asserting these positions and sharing videos. Well, I did the research, and they send me a YouTube video because I sit, after almost over a decade of formal education, training, fellowships, research, and whatnot, I am so not confident at all in my own opinions. I double and triple check with like 3 or 4 more people who I know are smarter than I am before I make a step. And so I am really impressed by these folks to have so much confidence, because I have imposter syndrome really badly. So
I got you. So continue on with the
debunking.
breaking away from the conspiracy theorist grip that a lot of us unfortunately have on social media.
Yeah. So again, I would encourage folks to go to the source. This that is really something that I'm surprised that folks don't do more of. So I'm going to deviate from public health law a little bit, just because this is a particular case that grinds grinds my gears when people misquote it and misrepresent it. The infamous Baker case in Colorado, where the baker
Mm-hmm.
was fined by the Colorado board. I can't remember the name of it right now, for
Yes.
not baking the cake for two different homosexual couples.
Yeah.
And so many people see how it went to the Supreme Court and say, the baker won. He doesn't have to bake this cake, blah, blah, blah. And they read whatever clips. And I'm like,
Mm-hmm.
no, that's not what happened in the case at all. That's not what the
Mm-hmm.
Supreme Court said. The Supreme Court was a very narrow decision, a very narrow holding, that they were trying to decide
Mm-hmm.
whether the Colorado board had misapplied its own law
Yeah.
and had, in some way, in a discriminatory way, basically against the man's religion and its findings, and said,
Mm-hmm.
you've got to go back and do this again. They didn't explicitly say whether the baker was right or whether the couples were right. They just said, hey, this wasn't handled right. You've got to go back and fix it. So I've mentioned this to people, and they always say, oh, well, how do you know? And I'm like, you can read the case. Like, it's right there. And I
Yeah.
know that cases are very long and tedious, and they can be hard to read. And I understand it's easier
Mm-hmm.
said than done. There's a reason why people go to law school and why people are, attorneys, is that they learn how to read the law. It's not easy for everyone. It should be, because it applies to all of us, but that's a rant for another day.
Ooh, you know what? I would love for you to, and I hope that you possibly have an idea about this character, especially, I think he died maybe 2 years ago, and he was a, a black health guru from, I believe, Costa Rica. Have you ever heard of this gentleman? His name is Dr. Sebi.
Oh, yeah.
So, what do you know about Dr. Sebi?
Oh gosh, refresh my memory of
So
everything that happened there.
it was said that he cured many people of AIDS, HIV, and he won his case against the New York Supreme Court. And yeah, yeah, kind of like, the sort of vague description that you brought up with the Colorado case. It's the
Yeah.
same sort of
And you
situation.
know what? I can't remember exactly what the case was right now, but I do remember it was a very similar situation of
Hmm.
folks just kind of looked at a couple of sentences and came to
Yeah.
this conclusion. And oh, yeah, I had blocked all of that out of memory. Sometimes there's just so much foolishness that I just gotta block it out. But as soon as you said his name, I was like, it's coming back to me.
Hey, it's all
Yeah.
good. But I understand that a lot of folks are looking for hope or just a means of understanding. A lot of people may be confused by the educated world out there, and they want to have a sense of hope and understanding, especially with things that's dealing with their physical health, emotional health, mental
Mhm.
health, etc. Elizabeth, I definitely want to have you come back on again. If ever you want to come back on, I want to talk a little bit more in the future, if it is at all possible, about how public health and autism and the care of special education, especially when it comes to minority parents as well. And I've got a few opinions on that, and I'd love to hear your opinion as well, but not right now. I think we've kind of run our time as far as our discussion, and I really love this opportunity, you coming on and just talking and everything like that. So, if you have anything you want to share, last parting words to the folks, that the 4 or 5 folks that's checking us out, share it with us, and let's do our thing. Go ahead.
So the last parting thoughts are to try to be more aware of your biases.
Hmm.
Um, put some good out in the world. Uh, you know, and wash your hands. We're in the
Yes.
middle of a pandemic. Wash your hands and wear your mask when you're out in public.
Hmm.
And if you are ever, skeptical about something that you read or something that you see out there, don't be afraid to reach out to someone who who might give you some expertise. I have amazing friends and even just folks who are acquaintances who I've not really met in person before, but I've added them on Facebook. And I'm like, hey, I know this person knows something. Let me ask them for some help on how to navigate this issue, because it never hurts to ask for help. And always go to the primary source if you can. If there is a primary source, go there before you go anywhere else.
Yes,
Yeah.
absolutely. All right. Well, hey, Liz, I really appreciate you coming and talking with me for about 50 minutes of just policy and health. And my goodness, you've renewed my heart
I'm glad to hear it.
regarding just I want to be able to implement change. As you said to me prior to our discussion, you wanted to create change, and you can't do that necessarily by just being a doctor.
Right.
If you actually have a position in law that you could actually enact or research or provide information that may create policy, that's even greater change. And I think that's a heck of a thing that you're doing. So,
Thank
shout
you.
out to you, shout out to you, shout out to you. So thank you, Liz, and I'm looking forward to talking to you again.
Same here. And I hope to see you enrolled in law school soon.
Oh yeah, it's coming. It's coming. All right. All right, Liz, take it easy. All right. So Liz was absolutely cool to talk with. Do your research. Break yourself away from conspiracies. Conspiracy theories can be harmful to you, especially if it's being spread to a very susceptible group. There's no shame in not knowing. Do the research. There's other people that actually know what's up. You're not supposed to know everything. Okay. So, as I always say in parting, take care of yourself, take care of your family, and take care of others. Peace.